I'm Dr. Phoenix, and I'm founder and manager of the Breathe Easy Asthma Home Visiting Program. So there's a lot of research that shows that if you can help families in their home environment address the triggers at home, that they don't end up in the emergency, their children don't end up in the emergency room or in the hospital as often. And I wanted DC to have the benefit of that because DC is one of the cities in the nation that has the highest incidence of asthma.
In DC, we're seeing so many children that have this unhealthy housing that are triggered at home. So the parent is doing everything right. They're giving the medication as directed. They have an asthma action plan. They're following it. They're going to all these specialists, but the child is still getting sick because they're living in a home that has mold, mice, mildew, pests. And oftentimes, or sometimes at least, their landlord isn't responsive or they're having financial difficulty in fixing it. And that's where programs like what we do in Impact DC, we leverage community resources, we leverage partnerships to try to address that issue and stop that trigger so the child can live happy and healthy.
So we put the program together, and the services that we provide for families include dust mite covers for children's beds, HEPA vacuums to help them clean the allergic dust particles out of their carpeting, and also a free pest management service and smoking cessation services for family members who may be smoking to help them quit. And we've been doing the program for 4 or 5 years. We've grown over the years, grown in terms of numbers, but also in terms of the services that we offer.
When she came in with that vacuum, I said, hallelujah, because the pulmonologist told me you are no longer able to vacuum in your home. I was like, at all? He said, you can't do it. Because the last time I actually vacuumed, I didn't realize it. I actually triggered her asthma, and I had to rush her to pulmonary because she was having such a bad time with her cough. And so it's just been a blessing to have these resources in the city to be able to vacuum without rushing a child to the emergency room.
Recently, in the last year, we formed a partnership with an organization called Yahad because we were seeing that some homes had issues that went beyond what we were able to provide in the home visiting program. They had structural problems, leaks, mold, things that we really needed a home repair organization to address. So if families need that, and after they've been seen through our program, we refer them to Yahad. We work closely with Yahad to coordinate those services so that we can really address all of the needs that families may have to reduce asthma triggers in the home environment and help to keep homes more allergy friendly and to help the children stay healthier.
I think one of the biggest concerns that I have as a mom with Abria having asthma, and I think I can speak for all moms, is how do we care for this beautiful child who does have asthma and be able to provide for them? How do I balance keeping my home safe and it not being a trigger and being able to provide for her financially? Am I doing enough? Is she going to be okay, or do I need to do more, or?
Can you tell me what your name is?
My name is Bria.
And how old are you?
I'm 8.
Yeah, what do you want to be when you grow up?
Doctor.
What kind of doctor do you want to be when you get older?
Me.